Thank you, Madam President. Wanted to come to visit with you today and the members of this body with some concerns I have about people who are being impacted by the health care law. And by impacted, I mean hurt. Their lives are being hurt as a result of the impact of the health care law. We are seeing it around the country as people trying to comply with the law. We're finding that many people are losing their jobs or part of their jobs, if they're working part-time, to be held under 30 hours a week, because under that criteria, people working fewer than 30 hours a week do not have to be provided with health insurance. And we've seen stories around the country of municipalities, public employees who are having their hours cut, and as a result, obviously, their take-home pay cut, their wages cut, as a result of the impact of the health care law as communities try to comply with all of the aspects of the law. We've seen it with in police forces, with teachers, with coaches, bus drivers, custodians, cafeteria workers, office clerks, sanitation workers, emergency personnel, university faculty, people all around the country who are being hurt as a result of the law. Members of the Senate come from my side of the aisle to read letters of folks who have been harmed by the health care law, and the majority leader comes to the floor and says that these stories are lies. These are stories from people at home who I talk to on weekends. I'll be this weekend in Buffalo, Wyoming at the health fair there, having a chance to visit with folks who are from Wyoming who go to a health fair for low-cost blood screening, also to go and visit booths that are there with from the Heart Association, the Cancer Society, the Diabetes Association, all taking efforts to try to improve the quality of their life, the quality of their care, and the quality of their overall health. And it's interesting to hear from these people because I don't think the President hears from them. And when I hear the majority leader saying that the people that come to the floor to talk about them, that these stories are lies, it's calling the people of Wyoming who have honest concerns about the way their lives have been impacted by the health care law as being untruthful. So I've come to the floor with more letters today and to talk about some things. It does make me wonder, though, when the majority leader comes and says these things aren't truthful, if he isn't hearing the stories from the police officers and the teachers and the coaches and the bus drivers and the custodians, the cafeteria workers, the office clerks, the sanitation workers, the emergency personnel, the university faculty in states all around the country who have had their lives impacted by the health care law. What I do think is that other senators who perhaps go home more often than the majority leader, senators who maybe listen to their constituents more and read the letters, are seeing the damage that is being done by the health care law because the President is responding to their claims, their concerns, and to the point that the President himself has unilaterally delayed many components of the health care law. These are the delays from 2013. Here's a calendar for the year, and all of the X's are different days where there have been different delays. There have been dozens of delays as a result of the health care law impact on the families across the country. So I'd like to read just a couple of emails about the impact on lives of people in Wyoming. There's a gentleman from Casper, my hometown. I was there Monday. I'll be there again tomorrow. He writes, my wife and I just received our new monthly premium information for our health insurance. As of March 1st, 2014, it will go from $505 a month to $1,045 a month. So, as he says, an increase of over double. He said, this is for a bronze level plan with a high deductible and high out-of-pocket. I wish the President would actually kind of understand what the impact of this law has been on American families. I wish people that supported this, campaigned for it, would realize the impact on people's lives. So he's gotten his premiums going from $505 a month to over $1,000 a month, to double the increase. Bronze level plan, what the President wants people to have, but it's the minimum level, and it has a high deductible and high out-of-pocket. He said it's also the cheapest plan that I've found so far. For us, it is available in Wyoming and complies with the law. Because the law says this man needs a lot of insurance. Maybe he doesn't need it. President doesn't know this man, doesn't know his life, doesn't know his history, doesn't know what he actually needs in terms of insurance. But the president claims, and the Democrats who voted for this health care law believe, that they know better than this man what he needs. But you know what we do find out is that when he wants to comply with the law, his insurance premiums more than double for the cheapest plan, which has the highest deductible and the highest out-of-pocket. He said this increase will mean that money we would probably have spent elsewhere will now need to be budgeted for the insurance increase. Well, we go across the state to Moran, Wyoming. Another resident of Wyoming writes, he said, I'm a resident in Wyoming and about half of my income comes from Social Security. He said, my benefits total $958 a month. He says, in addition to that, I work part-time at a ranch in that community, and he said it is a seasonal job from May to October. He said, I make about the same amount there as I do from Social Security. I've recently managed to submit an application for health care through the healthcare.gov website. He said, the cost to me with my current income would be a low end of $837 a month with a $4,000 deductible. He said, the high end would be over $1,300 a month with a $1,000 deductible. He said, neither of these amounts are possible with my income range. I would not be able to afford to live. He said, now I refigured this with only my Social Security income and found that it would be very affordable, lower deductible, lower premiums, of course, but he wouldn't have the income. He said, I could possibly afford that, but would have to live in a very substandard poverty lifestyle by quitting working. So he has these options. He can continue what he does, but he can't afford the insurance, or he can get affordable insurance by quit working, but can't then afford to live. This is what the President of the United States and the Democrats have given the people of America. He said, I would like to work and contribute as long as I'm able, but things are looking pretty bleak for me. This is a man that wants to work. This is a man who wants to work. But the health care law is making it a lot harder for him to do so. He said, I'm giving you this information in the hope that it will be of some value in combating the unfairness of the Affordable Care Act. The unfairness of the Affordable Care Act. I have to believe that senators on both sides of the aisle who actually go home and listen to their constituents hear about this, hear these stories all around the country, the unfairness of the Affordable Care Act. He then goes on and says, thank you so much for your service to our country and the great state of Wyoming. So here we have dozens of delays, and this is last year, and now it's happened again. Just yesterday, the President came up with another delay. And it's interesting the way that it is made front page of the New York Times, a paper that has supported the President, supported the law, front page above the fold, story by Robert Pear. The Obama administration, grappling with continued political fallout over its health care law, said Wednesday it would allow consumers to renew health insurance policies that did not comply with the new law for 2 more years. And this is the New York Times speaking, front page above the fold. This isn't me, but they're repeating the kind of things that I have been saying, pushing the issue well beyond the fall midterm elections. So what's the idea here? Push it out behind the elections. Make people not see the reality and the danger and the damage that is coming their way until after they vote. The article goes on, front page above the fold, today's New York Times. The reprieve was the latest in a series of waivers, deadline extensions, and unilateral actions by the administration. Here you have them. This is just in 2013. Now we have many more in 2014. Unilateral actions by the administration that have drawn criticism from the law's opponents and supporters, many saying President Obama was testing the limits of his powers. I believe that, Madam President. I believe the President has gone way beyond the limits of his powers. This says the action reflects the difficulties Mr. Obama, the President of the United States, who told the American people if they like what they have, they can keep it. If they like their doctor, they can keep their doctor. Who said insurance premiums would go down, all of which untrue. One called the lie of the year. The action reflects the difficulties Mr. Obama has faced in trying to build support for the Affordable Care Act and the uproar over his promise, which he later acknowledged had been overstated, that people who liked their insurance plans could keep them no matter what. Over 5 million Americans got letters of cancellation, 3,500 in the state of Wyoming. A woman with wonderful policy that worked for her family, lost her insurance because it didn't cover maternity coverage. She writes to me as a doctor and says, "Dr. Barrasso, please explain to the President of the United States that I've had a hysterectomy. I don't need maternity coverage." You would think the President would understand that. You would think that the Democrats who shoved this health care law down the throats of the American people would understand that as well. Now, this is the interesting. Still on the front page of this morning's New York Times. Under pressure from Democratic candidates who are struggling, Madam President, to defend the President's signature domestic policy, Mr. Obama in November announced a one-year reprieve for insurance plans that did not meet the minimum coverage requirements of the 2010 health care law. Wednesday's action, yesterday's action, it says, goes much further, essentially stalling for 2 more years one of the central tenets of the much-debated law, which was supposed to eliminate what White House officials called substandard insurance and junk policies. So if this is what the President believes, why is he now coming out and having a delay announced? Not coming to Congress, not saying, hey, let's try to do something a little different. Let me propose this. Let's bring it and have a bipartisan agreement to come up with some solutions to actually help people get what they wanted in the beginning with health care reform, the care they need from a doctor they choose at lower costs. The letters I'm reading show people not being able to do that. They're paying much higher for things that they don't need, don't want, will never use. We're hearing from people all across the country who are losing their doctor, can't keep their doctor, higher out-of-pocket costs, and we hear now the President wants to do some things unilaterally because a group of Democrat senators who are up for election are worried about their political future, not about the future of the American people and the health care of the American people. That's why they're doing this. And you say, well, no, that seems like an exaggeration. Well, let's go on. This next paragraph in the New York Times this morning, the extension could help Democrats in tight midterm election races because it may avoid the cancellation of policies that would otherwise have occurred at the height of the political campaign season this fall. So the cancellations are still going to happen. People are still going to continue to be hurt. We have over 5 million people who've gotten letters of cancellations, and it's not saying, oh, the cancellations will never happen. It's saying it's just going to push them out till after the election so people won't be as irritated and aggravated and angry at the Democrats who voted for it in an effort to try to save their election, to save their Senate seats, but not to help the American people. So this goes on. In announcing the new transition policy, the Department of Health and Human Services says it was devised in close consultation with members of Congress, and it gives, quote, credit to a number of Democrats in competitive races, including Senators Mary Landrieu of Louisiana, Senator Jeanne Shaheen of New Hampshire, and Mark Udall of Colorado. So the reason that the White House goes time after time, all these delays, all this and that, is not to help the American people. It's not to help patients. It's not to help the providers of health care. It's not to help the taxpayers. It's to help a couple of Democrat senators who they name, who the Secretary of Health and Human Services names as recipients of the help because the President is worried about Democrats losing elections this fall. Madam President, the Hill newspaper yesterday, new Obamacare delay to help midterm Dems. Not to help Americans, not to help the people from my state who write letters about the concerns of their lives, not to help all of these people who my colleagues and I continue to come to the floor with letters to tell their stories, to tell about their lives, to tell about the pain that they're suffering because of the health care law. It's not about the failed website. We all know the website. The President said, oh, it'll be easy to use as Amazon, cheaper than your cell phone bill. He said you'll be able to keep your doctor several days before the website opened and crashed. No, more than about the website. It's about people's lives. It's about if they're able to keep their doctor. It's about cuts to Medicare Advantage and hurting our seniors who are having a harder time getting doctors. It's about people paying higher premiums. It's about people having higher out-of-pocket, higher copays, higher deductibles, all of those things. It's about hospitals in states that are saying we're not part of any of these exchanges. People in the communities can't go there. They have to travel further distances. Nope, the president's not doing that for any of those reasons, not to help any of those people. He's doing it to help midterm Dems because they're afraid they're going to lose their seats. They're afraid to lose their majority. They're afraid they're going to be impacted and thrown out of office for absolutely reckless behavior on the part of a Congress who did not work in a bipartisan way, shoved a health care law down the throats of the American people in a way not to improve their lives, but to say that Congress knows better than people back home. Well, Madam President, I am going to continue to come to the floor with letters and stories. I'll be at the health fair in Buffalo, Wyoming on Saturday morning, talking to folks in my community, seeing what they have to say about their lives, their families, their jobs, their wages, those of them who are losing jobs or losing hours as a result of the health care law, those who cannot afford new insurance under the exchanges, even though they had insurance that they may have liked, even though they didn't like the price. It was cheaper than it is now, but the president said wasn't good enough for them. So I'm going to continue to work, Madam President, for solutions to help patients all across this country have patient-centered care, not government-centered care or insurance company-centered care, patient-centered care, to help patients get the care they need from a doctor that they choose at lower cost. A complete failure by this administration and by this health care law. Thank you, Madam President. I yield the floor. Suggest the absence of a quorum.